Hello, I'm Dr. Alan Bartham, and I am owner and clinic director of Carey Chiropractic Offices and Functional Medicine. And I'm here to introduce you to brain-based therapy, functional nutrition, and metabolic testing for the treatment of peripheral neuropathy. Now, I've been in practice for over 30 years and continue to study. I'm studying under Dr. Michael Johnson, who is author of many books actually. What do you do when the medications don't work? He also has a thyroid book and others. I also have been a student with the Apex Energetics Biomedical and Nutritional Products Group for treatment of chronic conditions, and I'm also presently a student of the Functional Medicine University. Presently I'm also a student of neurology, functional neurology that is. What is peripheral neuropathy? Well, peripheral neuropathy can be many things and combinations of many things. However, it is one of the most common chronic diseases in the United States. Over 20 million Americans have it. Peripheral neuropathy is a nerve damage, and it disrupts the body's ability to communicate with the muscles and the skin and the joints and the internal organs. It's like the body's electrical wiring is breaking down, causing numbness and pain, weakness, and poor coordination. A problem with the nerves that carry the information to and from the brain and the spinal nerves, and this can also produce pain, loss of sensation, and the inability to control the muscles. These are the 7 signs of peripheral neuropathy: numbness, burning or tingling in the feet, cramping, sharp electric pains, pain when walking, difficult sleeping from leg discomfort, and also loss of positional sensation. Now this can be very, very important, because when you lose your positional sensation, people literally do not know where their feet are, and they actually have to look down at their feet so they know where they're walking sometimes. When this occurs, this means the brain and the feet are not communicating well at all, because obviously with peripheral neuropathy, the nerves in the feet are not functioning properly. And over a period of time, these are the same people that will ultimately have serious balance problems, and the doctors are looking at this as an inner ear problem. But really what it is, it's a loss of communication between the feet and the brain, and now the balance mechanism is failing. The symptoms of peripheral neuropathy depend on the type of nerves that are being affected. There are 3 main types of nerves that can be affected. Those that carry sensations, those are the sensory nerves. Those that control muscles are motor nerves, and the ones that carry information to the organs of your body are autonomic. Now, movement difficulties. Damage to the motor fibers in your legs and feet interfere with the muscle control and can cause weakness. Some of the muscles bulk, and some will lose dexterity. Sometimes they'll even cramp, and that's a sign of motor nerve involvement. Now, peripheral neuropathy has a lot of common threads with a lot of other chronic conditions. All chronic conditions have some very, very common threads. Peripheral neuropathy has many commonalities with thyroid problems, fibromyalgia, type 2 diabetes, vertigo, sciatica, chronic fatigue syndrome, Crohn's disease, migraine headaches, the autism spectrum disorders. They all have some very common threads, and some of those common threads are metabolic imbalances, anemias, inflammation, that's the big one, and inflammation is where it all starts, adrenal gland problems, autoimmune disorders, food sensitivities, low oxygen, neurologic imbalances as well. All cases of these chronic problems, whether they're neurologic or metabolic, require proper neurologic treatment and metabolic treatment. These conditions are usually 60% neurologic and about 40% metabolic, but it can be the other way around as well. Your metabolism, this is something people need to understand, that your metabolism is how your body takes the food you eat and turns it into the energy you need to function every day. Your nervous system is your brain, your spinal cord, and all the nerves that come from that. We need proper metabolism, or that energy, for our nervous system to work properly. Okay? And guess what? We need a properly functioning nervous system for our metabolism to work properly as well. They're very, very interdependent on each other. Now, some of the neurologic and metabolic causes of peripheral neuropathy. A big one right now we're running into are statin drugs. Statin drugs are huge, and I will explain more about that shortly. Brain imbalances, damaged back problems leading to scar tissue, spinal stenosis, disc problems, diabetes, insulin resistance, thyroid problems, adrenal gland problems, chronic inflammation, you will hear that over and over again, food sensitivities, and hidden infections. These are all conditions that can lead to peripheral neuropathy, as well as some of these other chronic conditions that I'm talking about. Big one here is statin drugs. The statin drugs are being handed out like candy nowadays, and they can be very, very dangerous for human health. Statin drugs inhibit the formation of cholesterol. They also inhibit the formation of coenzyme Q10. CoQ10 is an enzyme that has many, many functions in the body. But if you're taking a statin drug, your doctor's got to be putting you on somewhere between 2, 4, even as much as 600 milligrams a day of CoQ10, because if you inhibit CoQ10 from being produced, because the cholesterol drug interferes with the liver's ability to do this, you can't generate ATP. ATP is the energy our bodies run on. After you eat all the food you have and it all breaks down to the most commonality of elements, ATP is what our bodies actually run on. Now, as we get older, we lose about 1% per year after about age 20 of our body's ability to produce ATP anyway. Therefore, when older people have a decreased potential for making ATP, then the doctor gives them statin medications, which suppresses their ATP more. And guess what? The nerves in their body aren't getting the energy they need to function properly, and then the frequency of firing, FOF, or frequency of firing of the nerves, will decrease. This is perceived by the brain as numbness, tingling, sometimes pain, depending on the fibers that are being affected. So your statin drugs can frequently cause your peripheral neuropathy, as well as diabetes. Now, a study from the Neurology Journal, May 2002, this is a medical journal now, it says that statin and cholesterol drugs increase the risk of peripheral neuropathy by 1,600%. I've seen some studies that say it can be raised as much as 4,500%, but to be on the conservative side, we'll call it 1,600%. But what they do is they block the body's ability to produce CoQ10, and this is why you need to supplement 200 to 400 milligrams daily, and your doctor should be telling you this. But being they don't read their own studies, I'm not sure you're hearing it. All right, they're hearing everything from the pharmaceutical salesman. Proper treatment for peripheral neuropathies. All right, supplement with 200 to 400 milligrams of CoQ10 if you're on a statin drug, right off the bat. Correct any nervous system abnormalities. Remember, your body operates because of your nervous system. And you have to diagnose and correct any metabolic abnormalities. Anemias, blood sugars, insulin resistance, poor diets, immune balance, thyroid problems, inflammation, and this is all done with proper testing and functional medicine. Also, you've got to make sure that there's no old problem of a back condition. About 40% of my peripheral neuropathy patients have been coming in here. We're not neurologic metabolic disorders, but we're seriously pinched nerves in their low backs, and this is as simple as getting that fixed. The nervous system controls and coordinates all the systems of the body and relates the individual to their environment. This is Gray's Anatomy. This is the fundamental book of anatomy for every doctor in this country. Your nervous system consists of your brain, your spinal cord, and your nerves. Your brain is your central command center computer, and the nerves are what communicate the signals from your brain to the rest of the body. Every cell in your body is dependent on those nerve signals to stay alive and healthy and functioning properly. Now, there's different stresses that will affect all this. Anemias, not enough oxygen, blood sugar imbalances, glucose, diabetic type problems, food sensitivities. This is where you hear people are now intolerant to glutens and soy and dairy. They cause massive inflammation in the body, and the inflammation causes the nerves to dysfunction. Immune system imbalances, patients are autoimmune, Hashimoto's thyroiditis, other conditions like that, Crohn's disease. Poor diet. Poor diet is huge in this country right now. The seasonally adjusted disorder, the standard American diet, I'm getting my acronyms confused. The standard American diet is very sad because it's mostly junk because we're eating so much processed food. We've got to get away from processed food, eat real food. Hypothyroid functions, prescription, non-prescription drugs. Here we go again, inflammation and hidden gut infections. These are metabolic problems that create nervous system problems, okay? Another one with stress is emotional stress. Emotional stress to the brain will cause your adrenal glands, the adrenal glands to imbalance, and the cortisol levels can be too high, in some cases too low, and this will have blood sugar effects on the body. High insulin and glucose levels cause the breakdown of the nervous system. The nerves start to dysfunction because insulin levels can be too high, or they can be too low and have high glucose instead. How do we find all this out? How do we find out what the problem is and where we go with this? Proper testing. Proper testing is incredibly important. And that's what we do here. We run a lot of tests based on your history. We may run any of the following tests and look at the functional values. Complete blood chem panel. Now you've heard these before from your medical office, but this will include thyroid markers, HA1C, lipids, CBCs without a differential. We're looking for anemias or infection. Salivary hormone testing. We've had very, very good success basically with salivary hormone testing. And we can look at the adrenal glands and other things with saliva. And stool ecology profiles if we have to, see if there's if the flora of the gut is working properly, see if there's an infection, H. pylori, or a parasite. These are all things that can affect this. And then finally, our number one lab we use, and is probably the best lab in the United States for testing for food sensitivities. Food sensitivities, including glutens and multiple other foods. If there is a food sensitivity, this can damage your stomach, damage your intestines, and you end up with a thing called leaky gut syndrome, which will lead to autoimmunity. Now remember, autoimmunity is where your immune system's working against you. We see these in conditions like thyroid disorders like Hashimoto's thyroiditis, rheumatoid arthritis, even multiple sclerosis. So these autoimmune testing is measuring to see if your immune system is actually attacking you instead of whatever bug may be in your body. Okay? Now, if your doctor has run a lot of tests on you and says your tests are all normal, but you still have all these conditions, it could be his analysis of what the lab tests are telling him, okay? Your doctor is using the lab values given to him by the lab. The labs determine what normal and abnormal is by comparing your lab work to everybody else's, and they end up with a big old bell curve average. All right? So if you're in the bell curve, you're normal. However, these lab values change from lab to lab, so what is the actual true values that are normal for human beings? They're called functional lab values or optimum. These are optimal levels for human beings, and they are set in stone. You cannot go by lab values because they're highly inaccurate, and the analysis of the lab, even though the lab may be accurate as far as the numbers are concerned, the analysis is miscued because of the labs and your doctor's listening to those people. For example, with blood sugar, and functional ranges or optimal range for a human being, your fasting blood sugar should be between 85 and 100. Traditional highs and lows are 85 or 65 to 110. I'm seeing them bringing the low end up now to 70, 75 sometimes. Okay. TSH, thyroid stimulating hormone. Your normal, the lab ranges for this are all over the place. 0.3 to 5.7. I see 5.5 to 6.0. They're all over the place. It should be 1.8 to 3.0. So your doctor may be analyzing your work wrong and telling you your labs are fine, and they may not be because of his analysis and the information that the labs are giving him. So the system of analysis and how we look at labs is very, very different from what they do. It's also much more accurate than what they do. Now, based on your lab findings, we may need to do a lot of different things. Huge is altering your diet. Remove the things from your diet. Maybe add other things. Prescribe specific nutritional supports from Apex Energetics and another company called PRL. Improve insulin resistance. We're going to possibly use nutritional support for the adrenal glands, for improving blood sugar levels, nerve regeneration, support thyroid glands, brain function, and bringing down inflammation. We'll give you a lot of supplements for over a short period of time so you don't have to take a lot later on and to bring your health back. Any supplements we put you on for the most part are only temporary until your body heals up. On top of this is something called brain-based therapy. Brain-based therapy, another term for this would be functional neurology. How is this different? Well, there's a lot. Brain-based therapy is finding the areas of your brain that are weak or not firing properly. Your brain can be working, but what's more important is the function of the brain working equally from side to side. And we have to find those areas of the brain that are weak and not firing properly and re-stimulate them and get them correcting, because guess what? Your entire body operates because of your brain. So if some area of your brain is not firing properly, we can't expect the body to heal itself. And this is called neuroplasticity. Of all the finds through is rewriting the textbooks, and it's a dawning realization that a brain older than 3 years of age used to be considered a rigid structure, And scientists long thought that it wasn't malleable or plastic, and we've now discovered, medicine actually has, that the brain continually reorganizes itself and heals itself, and that's called neuroplasticity. And it means that you create your brain from the input you get. So the more input you get, the better the brain works and heals itself. All right? There's two things that will make the brain activate properly, and actually there's three things, but they have it broken down into two. Fuel. Fuel is glucose, the nutrition, and oxygen. And oxygen and nutrition together is considered the fuel for the brain. And the other thing is activation. Activation is nothing more than the exercises we need to have you do to make those parts of the brain work better again. But if you don't have those three components put together, the brain will not function properly. So these are some of the therapies we use. If you can see this on my video, my technology isn't the best. But there are a lot of therapies we use for brain activation. And some of them may include oxygen therapies. Almost all these patients that we have come in here, we have them doing exercises, and we have them breathing oxygen, 95% oxygen, from oxygen concentrators, and this stimulates the brain to work better. Oxygen therapy, some vibration therapies to stimulate parts of the brain, very, very gentle spinal adjustments many times, and these are not for realigning the spine as much as they are stimulating for the brain. Warm water calorics, balance therapies, advanced muscle retraining, auricular therapies, different sounds in your ears will make the brain be more stimulated. And to this day, one of the best sounds in the ears for reactivating parts of the brain is Mr. Mozart. Mozart's still one of the best musics that will stimulate brain function. Olfactory stimulation, which is your sense of smell. We also use a device here called the Rebuilder. This is an electric device that re-energizes the nerves and gets them functioning properly, sometimes interactive metronomes and cold lasers as well. This is a photograph of our oxygen concentrators. They produce about 95% pure oxygen, and we use these while exercising to activate the cerebellum and the rest of the brain as well. Now, therapies used for other therapies used for it are visual stimulations, checkerboard pattern, eye exercises, mazes, all kinds of different, very creative things that we use to allow the brain to work better using the eyes. The eyes are the window to the brain, really. And this is a diagram or a photo of how the Rebuilder works. It's a set of socks. If it's a back problem, and a lot of you don't know this, and your doctor hasn't looked, but about 40% of the peripheral neuropathy cases that I've had, and I've been treating peripheral neuropathy for several years, are actually low back problems, and they have nothing to do with metabolism. They're old back problems that were never properly created. You have no back pain anymore, but the legs are failing. This is a classic sign of massive pressure on the nerves in the low back, and can be healed quite well without surgery. Now, we have the brain misfiring properly, we've got metabolic complications, we have been running all these tests, and we have all these loose ends, and we have to get it all put together. And we start addressing blood sugars and the hormones and the brain problems and oxygen deficits, cortisol. And what we do is we start working and we start retesting. And we measure our progress, and as we go along, if something's not working right, then we will alter our course until it does work right. But each one of these pieces of the pie start to come together. And as we get the brain working properly and the metabolism working properly, the pieces of our pie all start coming together. And retesting will help us communicating with the patient. The patient tells us how they're doing. We run a few tests to see how we're improving. And all these pieces of the pie just keep coming together until we finally have a whole person again. Peripheral neuropathy is not a foot problem, okay? It's a problem with your nervous system because your metabolism isn't functioning properly. Most often it's from inflammation, from bad foods or infections or hormonal imbalances causing these nerves to dysfunction. But it can be many things. We have to identify what those things are. When you're going to your doctor and he's treating you for peripheral neuropathy, he's giving you medication. How is that working for you? Probably not very well, and you have to take that medication for the rest of your life. And guess what happens with peripheral neuropathy? If you don't get to the cause of the problem, it gets worse. You can take all the drugs in the world to get rid of the symptoms, and most of you know that's not working well anyway, but the condition progresses on because you're not getting to the cause. The doctor is just treating the symptoms, and he's not getting the problem fixed, so then it gets worse. And guess what? If it's peripheral neuropathy in your feet, it goes up into the legs, and it continues to progress. It will go into the lower abdomen, It will cause GI dysfunction, genital urinary function. If it's in the hands, it will go up your arms and cause all kinds of dysfunction up here as well. So what's next? We want you folks to consider coming to our office for a consultation. I only accept about 10 new peripheral neuropathy patients a month, and there are some rules for acceptance. You know, you must be willing to make some serious life changes. You know, you've got to take accountability for your health. If you're truly interested and you're truly motivated to have somebody find the root cause of your problem and get your peripheral neuropathy straightened out by fixing the problem, not patching it over with drugs, not a Band-Aid, but finding the true cause of this so it doesn't get worse later on, this is the place you should be. Now, we use chiropractic, we use functional medicine, and we use functional neurology. We have combined 3 disciplines together in order to make this work. There is no silver bullet to this. It's a combination of a lot of testing and good treatment, but we can fix the problem and not just patch you up. Now think about this. On a scale of 1 to 10, how serious do you feel this illness is? Where you need to understand is, where do you see yourself in 3 or 4 or 5 years? Because it gets worse. How is it affecting your relationships? Can you play with your kids? Can you play with your grandkids? How active can you be? Are you starting to fall? Are you worried about falling all the time so you're watching where your feet are going? It could be your balance mechanisms are now failing as well. What are 3 things you could do if you didn't have this? Any boaters out there? You can't boat very often if you've got problems with your feet. You can't go out for walks in the park or anything else because you're afraid of falling. On a scale of 1 to 10, how serious are you about eliminating this illness? Now, due to time constraints, I can only accept those people who are truly committed. And if you're not truly committed, please don't come to me and ask for help unless you really want to know more about this and you want to get this resolved. When a person becomes my patient, we take it extremely serious. We don't fool around. We work hard, and we ask you to as well. So you need full commitment from you as well. Anyway, my name is Dr. Alan Barthen. Our number is 847-639-0010, and I would love to help you with your peripheral neuropathy. Please give us a call. Thank you.